Hello friends and welcome. I am Dr. Jaideep Somvanshi and I am a coloproctologist by profession, and I'll be inviting you to the video series which we are conducting at Panacea Clinic, Nashik. Panacea Clinic is a super specialty coloproctology center, and we are running this from the last 4 years, and we deal with complicated conditions of the rectum, anus and the colon like piles, fissures, complex fistulas, constipation, rectal prolapse, pilonidal sinus, etc. And in this video series, I'll be taking different topics, subjects, and we will be in short discussing what we can do to prevent happening of these diseases. Secondly, if you have these problems, how we can deal with it with home remedies and lifestyle changes. And also we will be discussing the treatment that is available for all these conditions, which may be medicinal, surgical or any holistic management. So let's begin talking about the types of constipation that we see in different individuals. So constipation can be classified into three main categories. The first is functional constipation. In functional constipation, the colon is normal, it is in good health, but there is somewhere a disturbance in the digestive mechanism. This can happen due to some of the diseases, underlying chronic conditions like irritable bowel syndrome or IBS, or the patients may be having Crohn's disease, or he also may be having more severe conditions like ulcerative colitis. So this may lead to constipation. Patient may have blood in stools, mucus or pus also in the stools, and basically the function of the colon is normal, but due to some digestive issues, the patient is facing the constipation problem. The second type of constipation that we commonly see is falls into the category colonoparesis, where the transit time of the colon, the stools passing through the colon, has reduced very much. Because of the slow transit time, the longer the stools stay in the colon, the more water and salts are absorbed. The stools become harder, drier, and which makes it very difficult to pass. This may be also come along with some abdominal pain, or the patient has the main symptom that he has to massage the abdomen before he can pass stool. The third symptom, the third type of constipation that we see is it is called as pelvic floor dysfunction. So there is some anatomical changes happening in the pelvic floor, either due to weakness in the pelvic floor muscles or pelvic floor dyssynergia, poor sitting habits or poor sensation. Patient does not have a proper sensation that he wants to pass motions now, and there may be also some kind of obstruction, right? There may be a rectocele, or there may be a rectorectal intersusception, which is causing pain, and this is very difficult for the person to pass motions out. So these are the three main types of constipation, which is functional constipation, colonoparesis and pelvic floor dysfunction. Yes, so now we'll be talking about how to take care of constipation, how to get relief from the symptoms of constipation. So there are many factors involved in treatment of constipation, but we will be first letting you know about how we can manage constipation by changes in our lifestyle and changes in our behavior. So first of all, I'll go for dietary management. In your diet, you should include plenty of fresh fruits, fresh vegetables, plenty of fiber should be included, and along with that, you need a wholesome diet. So you need to have plenty of ghee. Fluid intake should be increased. At least 3 liters of water per day is advised, and along with that, if you have different kinds of foods in your diet, don't go for a single type of food. So if you're eating paneer, then just don't go for paneer. You need to have salads, you need to have fruits, you need to have wheat along with that. So that will definitely help you. Secondly, you should also include some dairy in your diet. So curd is a very good probiotic, so that will also help in relieving you of your constipation, because it increases the good bacteria in your diet. Second thing I'll be talking about is use of laxatives. So if you are constipated, I will always go against self-medication, because many people start on laxatives which are available over the counter, and they go on abusing it, using it like they want, and that may cause serious problems for their health in the future. So before using laxatives, always consult a doctor, uh, so he can advise you on which is the laxative that is best suitable for you. So if you are having purely constipation and no other anal condition like fissures or piles, you may go for a bulk laxative like isabgol husk. If you're having conditions like fissures, piles, anal spasm, and there is pain when you pass motions, there is a fistula, then you should always go for a milder or a osmotic laxatives or stimulant laxative, which makes the stool softer and easier to pass. We are going to definitely make a separate video on which laxatives can be used and which laxative suits you best, as there are many laxatives available in the market. Third, I would like to talk about is exercise. Regular exercise helps you relieve stress. Relieving of stress is also helpful for relieving your constipation. Movement of the body helps in increasing the peristalsis movement in your intestine. So any kind of exercise, you can go for cardio, you can go for yoga. Simple stretching in the morning will also help, but you need to at least get in at least 30 minutes of exercise per day. Third thing to relieve constipation I'll be talking about is time management or timed dietary management. You should try to have a fixed timing, like when you wake up in the morning, you should have your breakfast within 30 to 45 minutes of waking up. You can have some warm water, you can have some fruits, you can have some stimulating drink if you want, but it is always better to have the urge to pass motions first thing in the morning. That is always better. Try to have your lunch and dinner at the same time. Try to eat your dinners early. It should be over within 8 p.m. and it should be lighter than your breakfast or your lunch. Next thing is, if you have the urge to pass motions in the morning, whenever you have the urge to pass motions, you should answer the urge within minutes. You should not wait. I have some work, I'll just finish this call, I just have to complete this assignment and then I will go. So that will go on increasing your constipation day by day. It is always better to answer the urge within minutes. And there are some of the small tips that I would let you know that will help you in relieving constipation. So first is the position that you sit in while you poop. So your back should be straight. The squatting position is the best, as the pelvic muscles are very nicely relaxed, and you have a better experience in passing motions, and you have the feeling that you have completely evacuated also. So I would suggest the Indian position or a squatting stool can also help in your Western toilets. One more thing I would like to add is fiber supplementation. So in regular Indian diet, we are having fiber, which is always included in our diet if we are mainly on eating plant-based foods, but we should know what is the minimum fiber requirement for a day. So for a human being, the minimum fiber requirement for a day is about 25 to 30 grams of fiber, which can help us evacuate ourselves better. So fiber supplementation is always necessary. If you are not getting your fiber supplementation from your diet, you can always go for supplements like isabgol husk or many other medicine that are available in the market. And one more thing I would like to add is, you should not sit for more than 10 minutes in the washroom. So if you are not evacuated completely, always sit for 10 minutes. If not, just get up and get along with your work. You can get another urge, then you can go and pass motions. Normally we are having about 5 to 6 major peristaltic movements throughout the day. So whenever that movement occurs for you, you can always go and find a toilet, but do not spend more than 10 minutes in the washroom. Don't take your newspapers or your mobile phones in the washroom. So these are some of the things that can help you relieve your constipation. There are other conditions in which, in spite of doing all these things, you are not getting the desired results. In such cases, you may always give us a call or visit us or consult us. We will be definitely happy to help you with that. So to conclude, constipation is a multifactorial condition, and it can present itself differently in different individuals. So hence proper assessment of the condition is very necessary, and do not hesitate to seek help whenever it is needed, because ignorance may lead you into a more complex disease or a condition which may make it difficult for you as well as your doctor to treat. So whenever you need help, we are here for you at Panacea Clinic. And so until next time, wish you the best of health, and see you in the next video. Thank you. Dr. Jaideep Somvanshi here, signing off.